Good morning, everyone. We will go ahead and get started. Welcome to Students at Work Healthcare Spotlight Day. We're glad you're here. And my name is Robin Mooring, and I'm the Students at Work coordinator. Just a couple of technical things. If everyone will make sure that they are muted. And then also, if you will put your view in speaker view, that will make sure that you can see the video and the presentation and the speaker all at the same time. And now I will turn it over. This session is focusing on Maynard Children's Hospital at Vidant Medical Center. And now I'm going to turn it over to Nancy Turner and Robin During with Maynard Children's Hospital.
Good morning. I'm Nancy Turner. I'm the program coordinator for Vidant Health Workforce Development. And we have with us today Robin During, and she is representing Maynard Children's Hospital. So I will now turn the program over to her, and she's going to share information with you.
Hey guys, I'm Robin During. So we have a little video that I created for y'all guys to watch, and then we'll do questions, I think, after at the end.
Yes.
Okay.
Welcome to Maynard Children's Hospital. My name is Robin During. I'm a professional development specialist here at Maynard Children's Hospital. I am going to give you a tour and kind of show you a little bit of what Maynard Children's Hospital looks like. So just a little bit of a background information for you is that Maynard Children's Hospital is the largest children's hospital on the East Coast of North Carolina. We cover 29 counties from state line of Virginia all the way down to the state line of South Carolina. So because of that, we see a lot of pediatric patients that really need our services here. And so we designed Maynard Children's Hospital for children specifically, so that when they come to the hospital, it's not nearly as scary as it can be. It is also set up to be able to help take care of their families while they're here too. If you'll notice on the outside of Children's Hospital, we have these big white looking things that kind of give shelter over our entrance. Those are our sails. So if you look closely as we walk through Children's Hospital, you'll see that it is set up to be a ship. And so we'll be under the sea for a little bit. We'll have portholes that we can see the sea life around, and when we first walk in the door, you're going to see the reception reef. It's immediately to your right. This is where our families come when they're not really sure where to go and what they need to do. So they will come here, talk to the guest hospitality specialist here. So I'm going to show you these amazing pictures of the sea life that is swimming from the ceiling. We also have a large enclosed fish tank for the children to go look at with saltwater fish in it. The guys come out and take care of it for us, so we don't have to worry about it. And you just get to see how beautiful our Children's Hospital is. Okay, as we walk down this hallway, you'll notice that it has curves in it. And part of the reason that it has curves is that they found through studies that children are less likely to be scared if it has some sort of motion and not just a straight line hallway, narrow all the way down. This pathway leads us down to where they do like radiology. We have our patients that come in that just need x-rays or little procedures done that can be done on the outside and then sent home. They come in here, they will come down and wait in this little waiting area. And further down is the Ronald McDonald house, and I'll show you some pictures of the Ronald McDonald house and how interesting that is and what it means to Eastern North Carolina for us to have an Ronald McDonald house inside a children's hospital. It's one of the largest ones in the country. Here in the little waiting area for radiology and P-Day, where our patients come in for their outpatient procedures, most of the time it's will be like our pediatric patients that have cancer and they need to have a treatment done, or our patients that have sickle cell and they need to have a transfusion done. They'll come in here and meet our staff, and our staff will take care of them, and then they can go home. They don't have to be hospitalized for this one little procedure. And used to, we would hospitalize them overnight and then send them home the next day. Now we just bring them in for a couple of hours and they're able to go home, which is really great. So in this little waiting area, you will see we have interaction wall. The kids really love come and play over here. They can take and touch the wall. It goes from a beach scene to a under the sea. They're able to pop bubbles. It keeps them entertained and kind of relaxes them a little bit before they actually have to go back in P-Day or go back in the radiology area and have their procedure done. Most kids love it. Our adults love it too, but we're not allowed to play on it. Anyway, so let's go down here to Ronald McDonald House and let me show you some pictures here. This is where our families can come and stay. And while they're here at the hospital with their child, they're able to come down here, wash clothes, shower, make a meal, get some food, because families come in and they donate food for it. And so they'll cook meals down here for them. They're able to come and relax. It's more like a home feeling. There's a little play area for kids so that the younger kids or their siblings have a place to kind of, get away from the hospital setting. This is a way that the family can kind of relax a little bit and have a little bit of normalcy. It's really hard to have a normal life when you're in the hospital, but this at least gives them a little escape. They can come down here, catch a drink, or get a little snack, take that well-deserved shower that they've not been able to get, and then, they're able to go back and be next to their child. We also have a Ronald McDonald House across the street where families can stay. If they're greater than 30 miles away, they're allowed to come in and stay there so that they're close to their child. There is a small fee. I don't really remember what it is. Next, we're going to go to the second level of our little ship here, and we are going to look at Special Care Nursery. I'm going to give you a little idea what it's about, and I will also give you a little tour of our Picu. Special Care Nursery first is a 21-bed unit. It cares for infants that are hospitalized due to prematurity, that are ready to go home, that still need a little bit of monitoring, or parents need some help with their feeding and helping them grow a little bit. Each family has their own little private room. It's really neat. Actually, here's a picture of one of the rooms. We try to make it as comfortable as we can. Now, onto our Picu. So you may want to know what Picu stands for. It actually means Kids Immunosuppressed Specialty Unit. This is a 6-bed closed unit that we will staff with like 2 nurses and a care partner to cover all 6 of the patients, because we actually use this as for our oncology patients. So immunosuppressed is usually our oncology patients. We will put other well kids back here as long as they don't have any infections, because we have to be very, very careful for our patients that have the immunosuppressed issues going on, okay? So here's some rooms here that you can see. I'll show you through. There are some activity rooms. I'm going to show you our picture of one of our relaxation rooms where our team can put a patient in there, do procedures in there, and then they can look at the ceiling, watch a movie. They can blast off into space, or they can do sand art. They can change all the colors in the room to match whatever favorite color. It's just a good way to distract our children. We have a bell here that when our oncology patients finish up their last treatment, they get to ring the bell and go home. We make it a big deal. This is sometimes the reason why you'll see our colors different at night when you drive by Maynard Children's Hospital. So if you ever see a different color out there, if you look on Facebook, on our Maynard Children's Hospital Facebook page, it will probably tell you exactly why we changed the colors, because we allow the patients to actually go push the button to change it to the color that they want. And it's a great celebration for a lot of our families and patients that are getting ready to go home. The nursing staff join in. I mean, all the staff make it a big deal. Okay, next we're going to go to the Pediatric Intensive Care Unit. We call it Picu. This is where we take care of really, really sick kids. Usually our nurses have 1 to 2 patients when they're caring for them. We have a 12-bed Picu. It is very much for those very, very sick kids. These patients here really need a lot of attention. The nurses are constantly in their rooms. Our parents are still allowed to stay at bedside as long as they can, as long as there's nothing really, really bad going on with the child. The general peds floor is a 32-bed unit. Within this unit, we have 6 beds that can be our transitional care units. This is where our nurses could have 4 to 5 patients at a time, unless they're on the TCU hallway. That hallway only allows them to have 3 patients at a time because those kids are a little bit more busier. These are usually kids that have chronic problems. They are usually having a home ventilator. They have different things going on with them that it really makes it hard for the parents to take them home right now, or they've had an issue that they need to come in and have fixed. So these kids can be very, very busy. Once these kids are better, we just transition them home. We also have a playroom that our kids are allowed to go to at certain times that open. Our child life specialists run this. They will have toys that are age appropriate. They'll work with the kids. Our child life specialists are really great. They are such a benefit to Children's Hospital. They are also the ones that will do distraction. They're the ones that bring coloring books or bring an iPad. They help the parents understand what's going on. They will stay with the child and do little games with them when we have to do certain procedures. They give them a chance to play and be kids. We also have a teen room in there, so those teens can go in there and they can hang out, they can play video games and feel a little bit more like they're at home. Now, that's a little bit about our hospital and our units. Oh, wait, I forgot about NICU. So we have a neonatal intensive care unit, which is NICU. This unit has 50 beds. It's on the first floor. These are babies that are born premature and they need extra help with either breathing and growing. They just weren't ready to come be born yet. So these are really, really tiny babies in there. Most of our nurses down there will have a 1 to 2 or a 1 to 1. It just depends on the acuity of the patient. So they're very, very tiny. We don't really allow a lot of people down there because we don't want our babies catching anything. So even if we were walking around on a tour, that would not be an area that we could see. So now let me tell you a little bit about the staff around here. So everybody knows that there's pediatricians and that we have doctors around here and that, they go to school for 4 years, then they turn around and then they have like another 4 years of a residency, then they have another 4 years if they're doing a fellowship, if they're specializing, whether it's in pediatrics or going to the Picu or even down into NICU. So we have, a neonatologist down there. They're very much trained before they come here, and we do train our own, so that makes it nice. A lot of the residents from Brody School of Medicine come back and work with us. We really do enjoy having them come back and work with us. So we have them. We also have nurse practitioners. Now, our nurse practitioners are mostly in the NICU and the Picu. They are nurses that have gone back to school and become a nurse practitioner, and they're allowed to write orders, they help with procedures, they do procedures. They're almost like a physician's assistant that most people know about, except they're nurses. And most of them have worked here prior to going back to school, and now they've come back and they're helping us care for our patients in a different role. They're actually an extension to our attendings, our doctors, our primary doctors, so that they can help them when they're busy and have a lot going on. Then you have your nurses, our staff nurses that take care of these patients. Most of our staff nurses are 2-year to 4-year degrees. We really like them to be a 4-year degree BSN. However, we still take ADNs with them signing a contract that within 5 years they will get their BSN. We have found over time that BSN really does help a nurse grow, and so we want to encourage our staff to grow. Also, with helping the nurses, we have nursing assistants. So our nursing assistants are 1 and 2. They start off with going to, I think it's like a 3-year program, a 3-month program, and then a 6-month program. NA1s are 3 months, and then after that, NA2s are 6 months. And they have to take a little test, and they have to pass like a board, just like nursing does, to make sure that they can care for patients. And so ours will come in, and they, it sounds like a lot when we say they take care of 8 patients. Well, they do it with the help of the nurse, but they do a great job of it. They still take care of the patients. They will walk them, they'll hold them. They do different things with them, help change diapers, help feed them. They're really a great asset to our team. Also, within a hospital, you won't believe how many people make it run. We have even our own chef down in the cafeteria. We have our EVS team, our EVS, environmental services. They're our team. They come in and break down our rooms. They clean our rooms. They make sure our hospital is beautiful and clean, especially during times like this. They're wiping everything down to make sure that our patients don't catch anything here. We also have our secretaries who work really hard to answer the phone. They do a great job of making sure our families have what they need, and that helping the charge nurse who is running the whole unit at the time when they are here. I don't know how many of y'all will be going to medical school or going into medicine. It really is a very rewarding career, and it really is a great place. But I'll tell you, the best place of all is children's. Working in Maynard Children's Hospital, I tell everybody, it's one of the best places.
I only got one more fact. That's it.
A better place to me. I have been here off and on for about 28 years, and so it really is a great place. If I left and came back, that's
Come on, stop.
I was able to share Maynard Children's Hospital with you so that you could get a little peek at what we look like and what we do here, and just kind of have an idea of what happens here in Children's Hospital. Thank you.
Okay, guys, do y'all have any questions about Maynard Children's Hospital or, the type of staff we have here?
No.
Yes, there's a question here. It says, what types of shifts do various positions of work at the Children's Hospital setting?
So in our Picu and on our peds floor, our physicians actually will do 12-hour shifts. We have them on board 24/7. We do have some hospitalists that will come in and they may do 5 to 8 hours here in the hospital, but then they end up having to do clinic hours too. So it kind of varies. It's not like going to your doctor's office where they have to do 8 or 9 hours that during the day. They do work weekends, they do work holidays. We're 24/7, so they're available at all times.
Yes, ma'am. Thank you. Do we have other, so there's another question here. Do you have to have any certain certifications or special courses to work in a children's hospital setting versus another hospital?
Actually, no. What happens is that normally when our nurses go through nursing school, they only get a small portion of pediatric education. So when they actually come and they want to join Children's Hospital, we take them through a like what we call boot camps, but we do extensive training with them. We do simulation. We actually are able to help them grow in that setting so that they get more comfortable taking care of pediatric patients.
Why do you look like that?
Did
You
that
still
answer
there?
that
It did.
question?
Yes, thank you so much. Also, does the theme of the hospital change? It's one of the questions that we have.
No, currently we have not changed the theme of the hospital. It's still more of the beach theme and looking like under the sea and all. As we join ECU and change some things, I don't foresee us changing our theme. However, who knows what the future holds as we, take that exciting step of becoming ECU Health.
Thank you. And then there's another question here about the role of a nurse practitioner. What exactly is the role of a nurse practitioner?
So it really depends on what they do. Here in Children's Hospital, our nurse practitioners they can write orders, they can put lines in, they can, make decisions on a patient. They have to have a physician that oversees them, so they can't completely practice on their own. However, they're usually the ones that also help teach. They're also the ones that when the doctor is busy with something else, that they're able to go and take care of that patient. So they're an extension of the doctors and the physicians. It's just an advanced practice, and they've gone to school to get trained for all that.
Thank you. What courses did you find valuable, or do you think are valuable for as middle schoolers move into high school to take that would help prepare them for a nursing pathway?
Of course, our health science classes definitely helps. If they get to volunteer, being able to volunteer at hospitals, I know COVID has really kind of put a halt on some of that, but being able to volunteer, see what the hospital's like, so that, ask questions from a nurse if you know somebody in the medical field. Those are things that will kind of give you an idea of whether or not going into nursing, going to be a physician, or healthcare at all is what you really want to do.
And how does a student go about volunteering? How do they find out about those opportunities in their community?
So if it's a Vidant entity, we do have on our webpage a place where it talks about volunteering that you can go to. I'm not sure about other hospitals that are not in the Vidant system. They may have different protocols, or, may have to not have it available at this time. But they can always just call, I'm assuming, their main desk, and somebody ought to be able to direct them.
Is there a certain age at the hospital that you have to be able to volunteer?
I do not know that one. I will be honest. I know we've had people less than 16, but I'm not positive what the age is on that. Nancy may know.
I think you have to be 15 by the time the summer session starts, because they start in June, but they take applications in February, and it is an interview process to be selected for the volunteers.
Thank you. All right, we have another question. It says, what are some of the most common procedures that children receive at your hospital?
Most common, I would say, having surgery for appendicitis. That one we see quite a bit. Trauma, where they've had an accident, four-wheeler accidents, we see quite a bit of those. Car accidents for our teenagers, we'll see quite a bit. But then we have oncology patients, and then those kids that have cancer, so we treat them. We have other kids that have diabetes, they may come in. So it kind of varies back and forth depending on the season and what's going on with the patient.
So you mentioned the season. How does the season affect the what you see?
So that's a very good question, because normally like in the wintertime when that comes around, now COVID has become a big thing, but we used to see a lot of flu. Our babies would get like a common cold that was called RSV that would interfere with their breathing and them clearing their secretions. So we would see a lot during, it would start about October through about the end of February, March. Then come March, as spring comes, people start playing baseball, they start getting out more. That's when we start seeing the traumas. The kids that just get their driver's license during the summer, we'll see those kind of, four-wheeler accidents because they're out playing, car accidents because they're out going more. So that's how the seasons kind of change what we see. For our kids that don't know they have diabetes, normally we start seeing those after school ends when their diet changes, because they're able to eat different things and not just healthy school meals. They're able to eat whatever they want. And so sometimes we'll see that at the end of school seasons.
We have another question here about the volunteers. Do you know if the volunteers are being accepted as normal now as the COVID numbers go down, or are y'all still restricted? Do you know if you're accepting applications for this summer volunteer?
For this summer, they did accept applications, and I believe it was for a limited amount. I know that last year, what they accepted were ones that they had interviewed the year prior when they did not accept any. And again, it was a limited number that were accepted. So this year, the deadline to apply was in February, and they've probably closed that application window and are doing their interviews now. I'm not sure the number that they plan to accept, and I'm not really involved in that department. It's a different area. But if you do go to the Vidant Health website, vidanthealth.com, there is a link for volunteers, and it has information for adult volunteers, college volunteers, and then a separate section for what we call volunteens, which gives information and contact information for that department, where you can find out more information about the application process and the requirements and that type of information if you wanted to know more.
Thank you. In the last session, it was mentioned that there were job shadowing opportunities. Are there any job shadowing opportunities in the Children's Hospital, or typically, once there's less restrictions, are there job shadowing opportunities?
I'll go ahead and answer that. We currently are on hold because of COVID, but in normal times, our process for job shadowing is usually high school students, preferably juniors and seniors, because they've already taken some of their health science classes and they are familiar with what is going on in the hospital and the terminology and things that they're observing. And there are forms to fill out. We do require going forward now. We've always required vaccinations, so it's going to be your normal childhood immunizations. We do require the annual or current season flu vaccination. And now our new requirements is the full series of a COVID vaccination. We do require liability forms to be completed, so parental signatures would have to be on that. And then we also require non-employee education modules that they would log in and complete and print out certificates of completion. So once we're able to allow high school students on site to shadow, which may be within the next 6 months to a year, maybe next spring, we would prefer that they're in high school, have taken some of the health science courses, and then they would have to complete and be cleared by submitting all of those documents. And even once that's done, it would be up to that department. If it's flu season and RSV in the wintertime, a lot of times the pediatrics, the children's hospital, they're like, no, we just cannot have outside visitors. And they do a lot of visitor restrictions. Some areas such as the OR, they're like, no, we're not going to bring high school students in here just because of the things that you're going to see. We've had multiple situations where, I mean, obviously that's a lot for a student to see face to face. And if a student becomes nauseous or sick or what have you, and if they faint, then they become the patient. And that takes away from the staff that's truly taking care of an OR patient right there. So there's a lot to take into account when we have students such as high school students on site within the hospital setting. Preferably what we do with high schoolers is have a teacher contact us and set up a tour opportunity where we would walk through the units and talk to staff, but we would not go into patient rooms. And then I would be a contact for that. And I can put my email address in the chat for that information as well.
Thank you very much. That was good information. What are some of the traits that you would say that a person needs to have to be able to work in a children's hospital setting that may be different than another healthcare setting?
They've got to love children. And not just children, but they've got to be able to take care of the whole family. Even though it may be our child that's a child that is sick, their parents are going to need care too. Mainly what we look for are those people that are willing to learn, they want to work with children, and they enjoy being in healthcare. It's not a special trait. It's mainly that enjoying being around kids.
Thank you. We had another question here. It says, has COVID changed protocols or expectations for the people working at the hospitals as opposed to the way that it was before the pandemics began?
Oh, yes. Of course, we have a mask. Most of our protocols have changed, one, to not only protect our staff, but to protect our patients. We have certain ways that we handle our COVID patients versus our regular patients. Our mask that we wear it at all times when we're on the units or when we're, in open areas that we could be around patients. Our isolation, how we dress, as far as when we go into a room and gowning up, we've always done that when we've had a patient that's had infections, but COVID has made us stop and think about some of those things a little bit more careful, and to make sure that not only can we protect our staff, but we can protect those patients and the family. So COVID has opened our eyes to a lot of things that I feel like that are good changes in the future. It took quite a bit to get used to, and we're still adjusting as we learn and grow from COVID. But I feel like that a lot of things put in place were really, needed.
Thank you. Are there any more questions? I'm just looking through the chat to make sure that I have. What would you say? Do you have a number for the average salary of a nurse or the different levels of nursing at in the children's hospital, or it might be the same in just throughout the hospital system?
So it's the same throughout the system. We're not paid differently just because we work in children's. That would be nice, but we're not. Our salary is the same as if on the regular floor. I do not know what a new nurse makes, but I do know that a lot of our nurses make up to $40 an hour, depending on how long they've been here. And the certifications they've got. We've been changing how we recognize our nurses. If they do charge, which is they handle the unit, handle patients coming and going, or if they do coaching, which is training new nurses at the bedside, they get extra. They get like $1 to $2 extra to do those things. So it varies. I want to say our new nurses are making somewhere around 20 something an hour. And then some of our more experienced, maybe 40 or more. I do not know what nurse practitioners make. I know that as an educator, ours does go from about 35 an hour to about 50 an hour.
And are there other benefits that come along with the salary, such as health insurance or other benefits such as that?
Yes. So if you're working full-time, Vidant provides healthcare. They provide eye care. So they pay a portion and we pay a portion. So nobody's, so for our health benefits, we have those. They also provide us 401ks to help us with when we get ready to retire, that help us build up that retirement fund. Trying to think of some of the other benefits. We do have an employee assistant program that can help with, like, if you needed a lawyer or if you were going to adopt a child, they have those resources for you. So Vidant offers quite a bit to our team to make sure that we have the resources we need to be able to care for ourselves along with caring for the patients.
You just mentioned some of the self-care things. Do y'all have access to, I know that some places might either you get a discount somewhere or, anything for that self-care or for like if there, I don't know if the hospital has this, but a gym facility or anything, or is there?
So we have a wellness center. We actually have like one in the Husky, one in Washington, and one here in Greenville. Those we have access to. They closed for COVID. We just reopened. I know the one in Greenville. I'm not sure about Washington and the Huskies, but we do get a discount to go there. Other gyms in Greenville will offer discounts. I know that some of the like the uniform stores, some of those places you can go into, and if they, if you have a badge on, or they'll tell you, they may give you a discount because you're a hospital employee. And our hospital has been really working hard at getting more of those things out to us. Prior to COVID, we'd have massage massage therapists who were trying to get, things checked off. They would come in and do sessions for the nurses. We used to do what they call tea for the soul here. So there's different things in the community, and then we try to do different things here within the hospital.
Thank you. We have another question that just came in and says, if a student knows that they want to go into healthcare, focusing on children, but aren't sure what they want to do, where can they start in trying to figure that out? Or do you have any suggestions?
While they're in school, if they've got those resources to the health science teachers and stuff, they may know other people that they can talk to. Finding that mentor, normally someone knows somebody that's a doctor or a nurse, and if not, they may know somebody else that is. I tell Nancy a lot that I don't have a problem talking with students. I share my experiences and what I like about that, and then I can tell them, when you're in nursing school or when you're in your med student school, get as much exposure as you can, because then that'll kind of help guide you. I didn't think I wanted children's when I first started. I really thought I wanted adult trauma. However, when I got over into the pediatric area and started talking to some of the nurses, I fell in love with it. And that's where I wanted to be. And I think that is the key. I know when my youngest was in school, her friend was in health science at West Craven High School, and her goal was to become a neonatal nurse. And she knew I was a nurse here in Children's Hospital. And so she would ask me a lot of questions and we would talk about it because that was the only way she could really know what happens here, because we weren't allowing shadowing at that time.
Thank you. We are about at time and we appreciate your time today. Thank you so much. This was
I
very
would just
interesting.
chime in on what Robin had
Yes,
said,
please.
because these mostly are middle school students. But once you get into high school, some of your health science teachers, once you start taking those classes, if you're the student that puts forth that extra effort, those teachers can become your best friends. I've been on site with some of the schools, and you may see a class of 20 students where 10 of the students are just taking the class and the other 10 are so engaged that you can just tell that is going to be their career when they graduate. And there are also clubs or organizations. There's HOSA that a lot of the schools are involved in, where you are actually learning skills and doing hands-on activities and competitive events. You work your way up and you compete against other schools, and there's regional competition and state competitions. And that will afford you opportunities to learn more, not just about pediatrics, but all different types of healthcare. And then some of the schools that may not participate in HOSA, I think it's called Skills USA. So there's lots of different opportunities in your high schools once you get there to become more hands-on involved, and just to really seek out your teachers and ask them. If you have a health science teacher, they didn't just go to college and decide, I'm going to be a health science teacher. They are most likely a nurse or some kind of a respiratory therapist or some type of healthcare provider that is now a teacher. They have left that healthcare profession and most likely taken a pay cut because they have decided to give back to their community and are growing our future workforce. So they know the job in and out and have the passion to teach and to help you guys. So I highly encourage you to take the health science classes and make the most of those and ask lots of questions.
Thank you. I think we're good. Once again, if you look in the chat, Nancy Turner put her email in there. So if you have any follow-up questions, please follow up with Nancy Turner and feel free to ask her. She's been gracious by providing that email for you. And thank you all for joining us today for the Maynard Children's Hospital presentation. So this was great.
Thank you.
Thanks, guys.
All right, everybody have a great day.